Were you guys invited to the economic summit or anything?
No, I work for the National Taxpayers Union. We've been working on tax and fiscal responsibility issues for 40 years, actually. It's our 40th anniversary. And nobody said a word to us about the Fiscal Responsibility Summit, anything about healthcare, nothing else. We have not been asked for our input on any of that.
Is it fair to say that healthcare is a taxpayer issue?
Absolutely. If 1 out of every 4 tax dollars roughly goes toward healthcare, then absolutely it's one of the most important tax dollars.
Okay. Was ATR invited to the big healthcare summit tomorrow?
We were not.
How come?
Well, presumably because they didn't want to hear what we had to say, which is that we think that Americans ought to be in control of their health care, that they ought to see whatever doctor they want, they ought to be able to buy any health insurance plan that they want, or no health insurance plan at all. They should be using their own money in order to purchase their own health insurance unless they have a really catastrophic year. And those common sense things that apply to the rest of the free market, they don't want to hear at this healthcare conference.
So, what do we think? What do you think about going over there? You're going to go over and sit in the audience, aren't you?
Well, I'll try to get in. The problem is in this era of transparency, it doesn't seem to apply toward people petitioning their government. So you can't get into it without an invitation.
Oh, really? You have to have an invitation? I thought this was a big public meeting.
Well, it's public if you know the right people to get you in. Things aren't quite as transparent.
Well,
that's the American people.
Well, even if you weren't invited to speak at the summit, y'all are going to go sit in the audience and watch the summit and listen, aren't you?
I don't even know whether it's open to the public. I haven't, we don't have an invitation. I don't have information.
Well, where is it?
I don't know.
Oh, okay. So what you're saying is there's this big open summit, a big transparent summit that's supposed to involve everybody, all the stakeholders, but we don't know where it is or where. We don't know if we're invited and who's
we're
invited.
definitely not invited. I don't know who's invited, but that's probably bad.
Who should be sitting at the table? Patients, doctors?
Well, yeah, obviously patients and doctors should be there. People that are involved in health savings accounts should definitely be. Market is most present in healthcare today, should be there. I doubt they will be. It's going to be dominated by the unions. It's going to be dominated by the disease groups who pedal off of people's heartstrings and try to make the healthcare system more socialized. They don't do any good for anybody. And it'll be dominated by the state insurance commissioners. It'll be dominated by big companies like Blue Cross Blue Shield, by the unions, and by the large corporations that just want to get rid of their health care costs.
Well, the state either. You think that'd be a big help if Hillary were actually there?
Well, what they should do is they should do a seance and get Ira Magaziner and his ghost to show up. He was the person, fellow Rhode Islander, unfortunately, who was behind Hillary Care back in 1993, 1994. He was really the animating spirit behind Hillary Care. So I think in that spirit, they ought to get out some of that old 19th century parlor furniture they might have tucked away in the White House, do a seance, get Ira Magaziner, and maybe we can get Tom Daschle's limo driver to get him to the White House. But other than that, I don't know that they necessarily need the empty chair because there's enough bad ideas to go around.
You're coming to the summit tomorrow, aren't you?
We unfortunately were not invited to participate in the White House Healthcare Summit.
You didn't. Maybe your invitation was lost in the mail.
Maybe it was. As I was saying, Grace Marie Turner. If you ask anyone in this town, who should I talk to about healthcare? If you want to get any ideas, especially innovative ideas, something that that's not out there in the legislation, everyone would talk to her about it. So the fact that she wasn't invited to the summit, I think a lot of our colleagues on the free market side haven't heard from any of them.
There's going to be some really good suggestions.
No, all the suggestions will be the same ones we've heard from the SEIU, unfortunately from NFIB, from some of the larger employer groups. It's going to be that the government should either control or completely take over healthcare in the United States, that patients and doctors shouldn't be in charge, but bureaucrats and lawyers should be in charge.
We're also not asked for our input on healthcare, despite the fact that we've been pretty good advocates for free market solutions to our healthcare problems and keeping giant taxes and government-run healthcare out of people's lives.
Okay, what's wrong with government and healthcare? Come on.
There's a lot wrong with government healthcare. The fact that rationing would have to happen is probably tops among the list. Plus massive tax increases, which is not something that we're a big fan of. What's wrong with rationing? Well, what's wrong with rationing? There's lots of people getting put out in the street when they need treatment. and that's something that we see in a lot of countries like Canada.
If you were holding a healthcare summit, name names. Who should be at the table?
Well,
Anybody with fresh ideas. People, policy people,
yeah.
anybody. Who do you think?
Well, I mean, first of all, I would invite members of our consensus group. We have a ton of organizations from center, I would say center to right groups, from the Cato Institute, the Heritage Foundation, the National Center for Policy Analysis, and many other organizations that we don't agree on everything, and I think that's important because we have a lot of ideas, we have our own exchanges going on, but there's so much we do agree on, and that's that we want to keep decisions with patients, with doctors. We want to give people choice. I mean, President Obama said if you like the health care that you have, you can keep it, but all of his policies are going in the opposite direction from that.
Okay, I suggest, how about we all meet tomorrow morning? We get the entire consensus group.
How about we have a summit?
And we have our own summit. What do you think?
Well, apparently anyone can call a summit, so we should just have a meeting and call it a summit.
Okay.